首先是新加坡林源旭医师的分享。林医师是一位牙科医师，也是国际残疾与口腔健康协会咨询委员会成员。疫情期间，居家牙科治疗非常具有挑战性，而新加坡牙科团队坚守岗位，继续为养老院和居家的个案提供服务，体现有苦的人走不出去，有福的人就要走进去。同时，也是唯一无间断的牙科居家服务。现在就让我们一同来聆听林医师的分享。
Good morning, ladies and gentlemen. Good morning, Master. My name is David, and today we are going to share a story from Tzu Chi Singapore's side. So this is a story regarding domiciliary, or commonly known as home dental services. All right. So we all know that in Singapore, there's an aging population. And how fast are we aging? So in this year alone, in 2022, there's probably about 700,000 seniors in Singapore. And within 30 years, this number will rise to over 3 million. In the population of Singapore currently, it's just under 20% that's 65 years and above. And that elderly population in 30 years will grow to about 50%. So that's more than doubling the number of seniors. So what's more stark and more daunting for us is the percentage of seniors living alone. Currently, it's around 12%, and we don't know how fast this percentage is going to rise, but we will be seeing a larger number of seniors who are living alone in Singapore. And when they live alone, it means they are not able to seek medical treatment, they are not able to connect with people within the communities. And hopefully we were able to provide services to them to ensure that they have a good quality of life. Today's story is regarding Mr. J. Mr. J was seen by our home care nurses around 3 years ago. So he's a 62-year-old man. So he's aging. He has moderate learning disability. He has also agoraphobia, which is a form of social anxiety, and this is on the severe level. He finds extreme difficulty in getting out of his house. His main caregiver is his 85-year-old mom, and mom says that whenever she tries to bring him out into public, Mr. J will shout or display very aggressive, distressing behaviors. He may not want to take the public transport like buses or the MRT. And this makes seeking medical treatment, seeking dental treatment really, really difficult. So probably for the past 2 to 3 decades, he hasn't really seen a doctor or sought dental treatment. So during the initial visit by our home care nurses, our very own Tzu Chi home care nurses, Mr. J reported, or rather his mom reported that Mr. J is having problems eating. He doesn't want to eat. He pushes his food away because it seems that he has shaky teeth on his lower front, and likely this is a painful area for him. So our home care nurses tried their best to have a check and take some pictures. So at the start, Mr. J is really, really apprehensive because firstly, he hasn't really seen the dentist for a long, long period of time. He doesn't know what people are trying to do by trying to pry his mouth open. Thankfully, he started to yawn, and our home care nurses were able to snap some pictures in his mouth, and that really helped in our diagnosis later on. When we saw him, when the dental team went into their house, he was really, really apprehensive and also unfamiliar with the procedures. For example, when we placed a dental mirror into his mouth, he started to bite on it, thinking that maybe it's a spoon. Through a couple of initial visits, we were able to diagnose his dental problem. So we know that Mr. J has a severe form of gum disease, acute severe periodontitis with some level of desquamation. That means layers of his gums are coming off. It's exposing a red base, and there's bleeding. It's painful, definitely. He has very tenacious dental tartar, which are hard deposits on the teeth. So this makes his brushing difficult. It causes gum inflammation, and hence his teeth are painful and shaky. In addition, his lower teeth, which are the most shaky, is also very painful, and those are the ones that's causing him problems when he's eating. Even when putting a spoon and it touches the lower front teeth, he starts to be a bit apprehensive because it's really painful for him. Of course, it's not just dental problems that Mr. J faces. He faces other special care issues and challenges. For example, he's not going to cooperate as well as average dental patient on the dental chair. Secondly, because of his agoraphobia and difficulty getting out into public places, into the conventional dental clinics, he's going to have problems seeking treatment. So how are we going to solve his dental problems and his special care challenges? First and foremost, we embark on domiciliary dental care. How does this go? On a typical day in the morning, we'll prepare various items. We'll pack it into a bag. So we have to be really like Doraemon and pack everything nicely into a small package so that we can put it onto a cab and arrive at the destination. So this includes our dental equipments, extraction forceps, and if we are doing dental sedation, we will need oxygen tanks, emergency airway devices, blood pressure machine, suction, many things. Once we get to his location, we'll unpack everything and set it up like a mini dental clinic. So we'll put together a few pieces of furniture. We have to be creative about this. For example, the dental scaler, the dental polishing, the suction, the dustbin, and we have to put a few more furnitures for him to lie down on. So this is not the end of the story after the appointment. We still have to pack things up for waste that has bleeding on it, or sharps. We have to pack them into a secured plastic and bring them back into the clinic to dispose, because these are clinical waste and we can't throw them in residential areas. And there are also items we need to sterilize and autoclave to ensure the utmost quality in our dental services too. So other than providing domiciliary dental care, we are also providing various ways to optimize his cooperation. So at the start for Mr. J, we will teach him how to get used to having his teeth checked, for example, and of course, how to receive brushing. And we do this through various behavioral techniques like systematic desensitization or graded exposure. So for simple procedures, he can accept it with behavioral techniques. However, for more extensive procedures like extractions, deep cleaning, giving injections, we'll need to provide him with some sedatives to get him sedated. And when he's relaxed, we can do his dentistry and he won't be fighting against us. And I find this to be a good combination of different techniques to get different levels of dental treatment done for him. So through the visits, Mr. J got more close to us and he really accepted and welcomed us when we came. So for example, over here, Mr. J is able to accept blood pressure taking. He sticks his hand out for me. So after taking the sedative medicine, he lies there on himself. I'm really calm and we can get some dental treatment done. Over here, we are using a handphone to shine light into his mouth. So this was at the early stages of our domiciliary dental service. So we took a really good picture of his front teeth. As you can see, red and swollen areas, really a lot of dental tartar. However, within a few months, COVID-19 arrived and we did not see him for a year. During this period of time, there's a formation of more dental calculus, more dental tartar, and also bleeding gums. His family overseas could not come to support his dental visit, and also his long-term domestic helper had to move back to the country, and mom was not able to manage brushing on her own. So Mr. J's teeth get really, really bad. As you can see, some differences between pre-COVID and post-COVID. Pre-COVID, we could put on a simple apron, but post-COVID, we need to be in full PPE. And in a non-aircon condition, in 35 degrees Celsius in the afternoon, it's really, really hot. But anyway, we persevered, so that was great. And you can see his gum condition really, really improved. Before treatment, there was really a lot of issues. Other than gum issues, we noticed that his teeth has shifted previously because of the inflammation, and he has difficulty eating. After the treatment, we can see that his gums are healthy and pink. He's able to do some level of simple toothbrushing. His teeth are less shaky, and the front teeth has come together slightly. And he has also improved eating. He's definitely enjoying his food more. So the care of a person is beyond our scope of dental work, of course. And we don't just look at teeth when we provide for care. So in our Tzu Chi free clinic dental services, we work closely with our wider Tzu Chi medical services. So after COVID-19, we got in touch with more of our other like-minded colleagues and also other social organizations in Singapore that provide home-based care. So we were over here, we are advising his brother who has came back from overseas that Mr. J require a full body medical checkup. He needs eye checkup, he needs hearing checkup, dental of course, and probably even physiotherapy to strengthen his muscle because he's also aging. And over here, we have already started some work in collaboration with other organizations. So over here, we have an optometrist from Mainz. So when I'm doing my dental sedation, she's also able to take a look into Mr. J's eye to make sure that he doesn't have cataracts and his eyes are functional. So this is not just an eye checkup, but it builds up to in the future when they try to get Mr. J more used to public places, and when he can see well, he's more confident of going out into the public places and having a better and more enjoyable life. So over here, I've come to the end of my presentation, and I thank you all very, very much. I'd like to end off with a quote that small tissues can cause big issues, and a tender heart can hold great love. Over here, I would like to take the opportunity to thank my team in giving selflessly to our patients, some of whom are not so easy to manage, and holding on tight to help them despite the difficulties during this COVID-19 period. Mr. J's treatment would not have been possible without you all. Thank you and 感恩.